You need to know a lot. So my brain tomorrow is not the same as the brain I have today. And that's very important. We don't know yet exactly what's happening behind and why.
Hi, here is Markku Wilenius, and this is my interview with Dr. Christian Brogna. This is the interview with Christian Brogna, so welcome to the show.
Thank you very much for your invitation, kind invitation. Yeah.
We are here in this beautiful school of San Giuseppe de Merode, and our topic of today is brain and what happens in the brain. And this is because Christian is an international expert in advanced brain and spinal cord tumor surgery. So he's been working a lot with the brain. And when we think about the future of brain, we think about the future of human being and his or her relationship with his or her environment. So by and large, we're going to talk about how does that brain that we identify to be inside our skull actually work, and how can we work with the brain as well. But to start off with, I'd like to ask from you, Christian, how did it actually happen that you became interested in neurosurgeon and things that are happening in the brain?
Well, we are our brain, basically. So all our reality, all we think, all that happens is outside, actually is happening inside in our brain. And it was so complex that, since I like a little bit complexity, so I decided to be a neurosurgeon because there was, at that time when I started, we didn't know much about it really. And I thought, okay, we can operate in the brain, and at the same time we can learn from our operations. So what I did was I started to have an interest in brain tumor surgery when I was very young. I was a third year medical school, really. Actually, I went into neurosurgery as a young student. And then a few years later, I started becoming interested in awake surgery, which means operating on the brain while the patient is awake. So basically, you can somehow control his functions, know where they are, how they are built up, and eventually how you can manage them around in order to remove the lesion, remove the tumor, while preserving these functions. So when I say we learn while we operate, we are operating, is because we get an insight in the brain networks behind different functions while we operate. And we know that our brain is unique. Every one of us has a unique brain. What I say seems very now possibly normal. But I would say that only 10, 20 years ago, maybe this was not true, because we didn't know the way certain functions were changing overall throughout our life, how the networks behind those functions were built up and how they were really working. Now we have more insight into this.
Okay, very interesting. So you said that only like 10, 20 years ago, this area, what you have been kind of looking into, was more like in the beginning, and now there has been a rather fast development. And I know very well that you have been working in different parts of the world, from Sao Paulo to Istanbul to London to Vienna and France and so forth. So it seems like you spotted this area that you wanted to dive into, and then you went looking where was the best knowledge for you to learn. Was that so?
Exactly. So what I wanted was to pick up the best from the best people. And knowledge is not only one body. Knowledge has different features. I wanted to get access to many of them so that I could combine all those knowledges and philosophies on the patient in the right moment. So I needed to feel able to do what was needed according to what was really the right thing to do, which means the right thing is not what you know is the right thing. You need to know a lot. Many different philosophy, many different ways of doing the same thing, and then you can really decide with freedom what would be the best for you, your unique patient. Is your unique patient because is the patient you have in front of you in that moment of his life, in that moment of the surgeon's life, in that historical moment, in this historical scientific environment. So the algorithm is quite complex and quite unique for each patient. And I always wanted to keep this in mind, and for my mentors were always saying this. All of them, they were saying, you operate at one patient at a time. But the meaning was basically feel always that brain that you have in your hands will be different from any other brain you had before. Therefore, you cannot apply always the same techniques. You have to think you will face a different reality. Of course, there are general principles, but you really need to know your patient quite carefully. So going around the world, I also learned different cultures. And different patients have different cultures, and this means a different brain, different beliefs, different wishes. And the neurosurgeon has to take into account all of those, together with the evidence-based medicine, but also those wishes come into the big algorithm when you have to decide what would be the best treatment and operate on that brain and on the sense of self of that patient.
Very interesting. So, so it seems like in your journey, the science of the brain has changed and developed fast. You have also, as a part of your kind of a field of expertise, your ideas about how the brain actually works and operates has changed as well. And you say that the particular aspect of that is that the brains are actually much more individual than probably previously was thought, right? So which brings us a kind of a question that, and you were hinting on that when you said that they have discovered much more functions and probably also more connections that the brain actually possess. How does this fact that there is actually much more to it than was previously thought has actually impacted on your idea that of the sort of a long-term evolution of the brain itself?
Yes, Markku, that's true. So we always, in the last century, we're thinking that the brain was a fixed brain. So let's say we had a certain amount of neurons, which actually we have a lot of neurons, the same number as the stars of all the Milky Way. And that every neuron is connected to the others, about 10,000 connections at least. So imagine how big is this network. But we thought it was a fixed network. So let's say during childhood until 14, 15, you could empower your brain, and then there was only a decadence. Today, we understood that this is not true, thanks to the knowledge of neuroplasticity. So what happens is, it's true that we lose neurons throughout our life, but we are able to change continuously our connections. So my brain tomorrow is not the same as the brain I have today. It's not exactly the same. It's totally different. And this neuroplasticity works in a very short footage or in a long term. And the kind of also educational reserve we have, that's very important. So let's say if we have a very huge reserve, knowledge reserve, then we can use the connections we had much easily in a more plastic way, so we can change our mind in a more plastic way much easily. So the more we take into, the more our brain changes connections. And actually what we know now is that not only we can change our connections, but we have new neurons that every day are developing, especially in the hippocampus, which is in the limbic region of the brain, and especially in the periventricular area of the brain. So we have new neurons every day. And
this goes until our last days, so to say.
Yes. So this actually, it seems that decreases a little bit with age, but mostly probably due to the fact that our brain does not receive a very good arterial flow in the later stage. But if the arterial flow is maintained, actually, what we could see is that we have new neurons developing. And that's very important because two things then. We can change our connections, we have new neurons developing, they are not only dying neurons in our brain. So we change our reality continuously. We are able to change our reality.
But that's quite radical, actually, when we think about our classic idea of that, well, we start to decay actually somewhere in the 20s, and if not before the 30s, then at least in the 40s and 50s, and that's a kind of a story of decay. But what you're saying that no, it's not that way. It's actually the story of the regeneration of our brains. Now the question comes to a layman that what are the factors that defines how much of these new neurons are actually appearing? What pushes those new neurons? Obviously, there is a system that produces that, whether we want it or not. But is there also ways how we can improve it, kind of fasten this regeneration of the new neurons? And on the other hand, is there something that impedes that type of functioning of the brains?
So at present, strictly scientifically, what we know is that running or walking fast improves the amount of neurons produced daily in the hippocampus. We don't know yet exactly what's happening behind and why. but this is happening, and we know it for sure. The second thing I was talking about, our reserve. So the more we are motivated, interested in everything in life, then the bigger is our reserve, then the better we perform. So performance. So performance, there are lots of things behind performance actually. Well, motivation, projects, to have a project always, that's very important. And then at a certain level, for example, also in neurosurgery, when you have to increase your performance, you can use several tools, and one, I think, is one of the most important for me is the ability to perform a mental imagery, to visualize. To visualize something that has not happened yet, but will happen, or could happen. So when I need to operate someone, a few days earlier, I start thinking about the case, reviewing the images, rotating the patient's brain in my mind, visualizing the functions of the brain, the tumor, the lesion that I need to take it out, thinking how to take it out without damaging anything of the patient. So thinking about the patient wishes, what he told me during the consultations, what are his or her priorities. And then I start thinking about the surgery, but it's not just thinking, it's a visualization. It has to be a vivid visualization. You have to even feel the instruments in your hands, the light in the room, all the people that are around, and all the different scenarios. It takes a lot of energy to do this.
Oh, yes.
But if you do this at a certain level, your brain does not differentiate what is real and what is not. Therefore, you have performed that surgery already n times before actually doing it.
Well, this is extremely interesting from my own profession point of view, sort of from future studies and foresight. Because at the end of the day, what can you say about future? You can say things that comes to your mind. So it's like the only way that future exists is in your images, right? Now the question is that how this, what you imagine and visualize, how much it actually directs the way the future actually happens. And that brings us many more interesting things, from thinking that, well, actually we live in this quantum reality, even if this room here looks very stable and cool and quiet, but even this room is in a constant motion when you go to the quantum level. Now, thinking, you mentioned sort of three things here. So you mentioned first that when we are in the motion and in the running, that seems to generate more kind of this positive new neuron kind of a generation. I would think that maybe some of that has to do with the long evolution and the way that perhaps bringing us back to some of the nomad times, when we were more kind of a mobile, when we were not stable in the cities, but we were more, maybe that's something that evolution has started. But maybe I'm sure that you know that better. But the second instance what you gave about this, that there is this reserve, and reserve comes from how active you are in your mental life in a way, how much you are seeking the knowledge, how much you are into the project, as you said, how are you using our brains in an active way? It's a proactivity of the brain that itself produces then more and activize the neurons and sort of bring in more new neurons also into the brain. And then this third aspect was the mental visualization. Now, these three ways, and probably there are more, seem all to be kind of the factors. But if you look at the other side of it, what happens when we are starting to lose our capacity of brain? Let's say that we are living in this modern, rather chaotic society. So, well, they have been always chaotic, but now it's a different way because we have all the technological devices. We are splitting our time over the day. We are multitasking probably much more than we did just some time ago. So there is a very new environment that we have created into our modern, or I would say even postmodern society. What does that type of the environment, which also includes a lot of stress, what does it do to our brain?
So let's say there are two ways the brain can work. So it can makes a good focus on some subjects, specific subjects, be multitasking, but every task is one subject and the brain is stick to the subject without going around. It is focus, this is concentration, and this is good. But there is another part of the brain, another network, which is called default mode network, which actually is capable of integrating almost all parts of the brain in one shot. And this is very important because the majority of huge ideas and a better look to the world comes from the integration of different parts of the brain, realities, different knowledge, and different data. So when this brain is integrated, is at a full status of integration, is like what we call a pindaric flight. So you go above the Earth, and you can see the Earth from above, and see what's happening as a whole, and not just be stick to the little detail, but see to have a more metaphysical way of seeing things, which I believe is very important in our daily life. That is made a lot now of different tasks. We have to do tasks. We have to achieve little things in a specific way. That specific way, most of the time, is set by another one. It's not set by you yourself. It's not made in a unique way that it would suit you the best. Yes. So we have to empower ourselves and also push our mind in the following our mind itself. So when Socrates was saying, "Gnotis auton," you have to know yourself better. I would say in a neuroscientific way means to try to get access to this default mode network in a way you can see reality as a whole and have the reality take your route, your specific, unique route. In this way you can give to the world much more because you become creative. You are not just something that has already been decided. You're not just part of a system, but you can give to the system something unique.
Very, very interesting. So it's like what you're saying is that by this integration of the different parts of our brains and its functions, which is also, in my thinking, it's also the different parts of our mind, really, and the capacities that we are carrying, the way that we observe different things in the world, sensing different things, and kind of bringing them all together as if there was an intuition that helps us to do that. So what you're saying, that this is something of a movement forward where we can see also that when we are sort of deploying our brains in such a more holistic way. That is also something that builds a kind of resilience also towards the world, which asks us to be more split, to share our attention to very different things. But if we keep that kind of a integrated mind behind, then that's the way to build this stamina.
Mind behind, as you say, Marco, is the part of the brain that works the fastest. So I always say my mind is much smarter than I am. Because when I let my mind go, once you have experience in something, then you let her go. Possibly the mind is the one that can make the biggest calculations ever, that you cannot do rationally. There is no way to do it rationally. You have to let it go. The mind knows things probably months before you realize this was happening. And then it can guide your behaviors. But if we are very stuck to a certain kind of knowledge environment and is always the same, is always very fixed, then we cannot give freedom to this part of our mind. Therefore, we cannot really make these big calculations. We cannot integrate all the reality that we need to build our future.
Yes, because if we are sort of too patternized, that means that we are actually not deploying the full capacity, but we are only taking a little part of that. So, Christian, how did we meet?
So we met in Porto Ercole,
yes,
on the Argentario. L'Argentario is not an island; it's a peninsula, a small peninsula of Tuscany. So it's 1.5 hours from Rome, and it's a wonderful place. So basically, you were having breakfast with Brogna, and I was in the next table, and we just started talking. I don't know how, but we just started talking and talking and talking and talking. So after 1.5 hours, we realized it was late. We had to do something else, and it was so deep.
So it was like a meeting in an Italian cafe, and
by the seaside.
By the seaside, yes, in the very beautiful little village, a kind of fishing village, and it all came out very, very naturally. And I think out of that, I became very curious that what is it that you're really working on? Because our discussion sort of opened a really a vistas. How could I? And I could see in an interesting way how this your work is actually connected to my work, and this type of the synchronicity that arose out of those ideas that we were just brainstorming was hugely interesting. Now, continuing the discussion that we had early on, I think the next area that we like to touch is this. So how is it that there is this constant flow of ideas, mental models? Jung called them kind of archetypal models that we always have, but many of them are very transitory. So it's like there seems to be a kind of a constant flow of thoughts and ideas that go through our brains. How, from your perspective, what does it tell actually about our brains on the one hand, and then on the other, what does it speak to us in terms of how should we be kind of managing or controlling as well as creating our ideas?
Well, Marco, our thoughts are by definition impermanent. So they are made by neurons that connect each other, they synapse each other, they send some electrical waves, and that's done. So really thoughts are impermanent, therefore we can guide our thoughts. It's difficult, but we can guide. When we visualize our thoughts, we are starting building our own reality, once again because they are impermanent. So you can change the way we think, thanks to also neuroplasticity that we were talking about before, and neurogenesis. So what is reality? Does reality exist? Yes, of course, it exists. But what kind of reality we are looking at? Actually, there are so many different realities as many of us. Because our reality, when it comes into our brain through our senses, has already been filtered. So if you take the early painters from the 900s, they understood it quite early on, 100 years before the neuroscience. So when you have a painting, white painting with just a line, this line, when it's seen by the brain, has access to only the lower level neurons of the visual cortex. But then, so these neurons fire because they see a straight line and it's just like this, it's not vertical, it's just horizontal. So the neurons devoted to this, they will fire up. But the brain needs to give a meaning to it. Therefore, that meaning will be unique because it will not depend on the reality that is outside, but just on the reality that is inside, that you have built inside.
Very good. And that brings me to the topic. If it is so that our thoughts are in flow, they are transitory, sometimes though they need to be picking on us, and we are creating a habit of thinking in a certain way, so at least there are patterns of thoughts. But I think this impermanency, what you're referring to, is the kind of the core of it. So how do we develop our brains? What is it that, because I could think that we have many other organs, like eyes, for instance, and to me it has become quite clear that we can actually improve our eyesight, because eye has a lot of these little muscles, and when you start to work on those muscles, you can actually improve your eyesight. How is it with brains?
Well, you can train your brain. So whatever you do in your life, you're already training your brain. We are training at this moment, we are training our brain, which means basically we are using our brain, but while we are using it, it's changing. Therefore, we should use on the proper things. So what we really think is good for us. So, of course, we have to take out the pathologies. That's in another world, and this is different for. But let's say if there are no neurodegenerative pathologies, there are no other stuff as brain tumors, malformation, vascular malformations in the brain. So let's think that the brain has potentials to change continuously. So imagine when I was operating on a patient while he was awake, and he was playing saxophone while he was awake. And we had to do it because the tumor was located in the place where the fingers functions and the coordination between both hands is paramount. There are all the networks there regarding it. The issue was that the brain tumor was inside this area. So I had to map this area, but what we can see during the surgery, that the same networks that we have found just before starting removing the tumor, they change straight away. Some of them, there is an acute neuroplasticity that works. And this is like, you see in your hands, really. You see, so while he was playing, despite I had to remove some hubs of the network because they were infiltrated by the tumor, I had to take out the tumor. That was important. Anyway, he could continue to play.
So there was an instant...
There was an instant neuroplasticity, and the network instantly changed, so that it could continue to play anyway. Even a hub of the network was damaged. And this is because many functions of the brain works in parallel networks, where even if you destroy one network, the other parallel part of the network can start building up new connections and behave as the wall, as nothing happened.
So, what I see it is like the brain in that situation is self-organizing itself, right? So, as if there was an intelligence behind that says, okay, now I need to produce something extra there because something has been taken away, and the system acts as a whole, even if there are kind of a individual kind of a single activities that goes with that. But what does it tell us actually about the way, if this is the way the brain functions, obviously this is the way the whole human being functions, because it's, I guess the idea is that what happens in one part actually happens in another part, even if, of course, the functions are different, but the way of operation. So what does this tell to you about the human capacity to regenerate in general?
Well, the reality we said that possibly exists only in our minds. Therefore, I believe that the reality is made in the way our mind is made. So the system that works in parallel in our mind to produce functions possibly are the same systems that are outside and we develop. We think we are developing, but actually probably they are a mirror of our brain functions. So the way as a whole, as a human beings work, I agree with you, Markku. Probably, and you are more expert on this side than I am, they are probably a mirroring of our own brain structure.
And that also the other idea is brought to my mind because we are in this beautiful educational building. Would you imagine that one day we start to work as in a kind of a conscious way to actually learn how to improve our capacity through the specific techniques and methods that we can learn out of the science that has gone already so far, and probably we still go much further. That there would be this kind of idea that let's connect this to our real challenge of this world, which is that how do we learn, and how do we learn faster, and how do we use our human capacities in a much better way? Because to me, all of what you're telling us is that, well, we're always talking about the topics and the subjects, and should we be learning biology or geology or mathematics or what? But we should actually ask preceding question that how does the kind of a machinery, which is of course not a nice metaphor because we are really not machines, but machinery or capacity, how can we improve that, which is, and should that be a discipline in our learning institutions as well?
Definitely, it should be. So this is an educational important hub, and I talk with the children, with the young boys, young girls, and what I always find is the need for them to understand the potentiality of their own brain. They need to know about their brain. So we are not taught enough when we are very young about our brain. So, and then sometimes I give lessons to them, and I have to say it's very important to find the right words and get them really motivated. And I can see they are motivated as soon as they understand they can become whatever they want. There's no limit. But so we are used to think about fixed educational processes. However, they are not. And I think also the younger generations are already aware somehow about this. The way they look around for information is so different from my generation and yours. The way they integrate information is very, very different. But they have to be aware why they are doing this, and they have then to structure their information in the proper way. So, but once again, once they know, these young boys and young girls, they know they can really become what they want. They should never follow what the others want for them, but they have to feel who they are. And I know this is almost a metaphysical and a philosophical issue, but then they can really put their energy and they can visualize their future. And I remember actually, I was always visualizing my future. I could visualize where I am now when I was young.
Yes?
Yes, definitely.
Okay, but that seems...
And then I could see that every effort, even when it was not an effort, a structured effort or a rational effort, was made at the end toward this path. Because I had very clear in my mind where I wanted to be, how I wanted to feel. And this is visualization, and
this
how
is a
this can change reality.
Yes. Yes, yes, very, very interesting, and indeed, you in a way, you demonstrate that this is really working, and of course, this comes. What I always tell also to my students that that we are actually creators, and then we can create our future. But it really asks for the focus. It cannot be a whimsy idea that goes away. We need to come back to that and see that that is actually something which is really driving us. And then somehow, maybe even a little bit mysteriously, we can end up being something that we have visualized, which you just explain what happened to you. Now, that brings me to another topic, which is almost our final topic, and that is that you said also here when you were a pupil here that there was religion was a part of this. This is a Catholic institute as well, and regardless of the actually religious background, there is this kind of eternal, sometimes philosophical, sometimes very practical question about what is the relationship between the brain, mind, and spirit. And I think that we have gone through some ways different stages in understanding the what is the role of the brain and what is the role of our material existence in a way. But then there is this kind of a part of us which I think in the different times and comes in a different way, which is that, well, if all that is true, that one of our key capacities to visualize, but also that one of our key capacity is to be connected, something which is beyond this material existence. How does it appear to you as you spend your days with working with a very kind of a tangible stuff called brain, but at the same time you have seen how immense capacities human mind actually has. So how do you solve this issue that what is the relationship between the brain and the mind and the spirit?
It's a hard question.
I know.
Well, I cannot give a generalized answer. How do personally solve this? I think we are really highly intelligent human beings, and our capacity is so huge that it's not made just for simple stuff. We are made for complexities. And whatever is complex, somehow we like it. Therefore, we always have to get to a stage where we get out of the reality and go to another different level that actually is in our mind. Is there first. Then you can transmit. And then you can transmit even without saying a word, but just with what you are doing, thanks to this philosophical thinking. Because the way you behave is your metaphysical way of being, your sense of self, and we get to a higher level. And I think the brain possibly has this so complex structure that we can get to a whole world connections where synchronicity, for example, have a huge place. And our thoughts, I really believe, can guide us. Can guide us and the others and the world in a very strong way. Because at the end, what, as we say, when we are born, then we have to deploy a life. And what is a life other than the building structures of our continuous dreaming? Because once we achieve something, that what happens normally, we dream something else. So we are in a continuous state of dreaming, thinking about a new reality, thinking about future. Now, we should always balance being mindful
here and now.
Here and now, which is important. But I think actually the two things are somehow stuck together. So when we are mindful in the present, we get notice things that will be very important for our future, more than if we just think about our future, we are not in the present moment. And we get opportunities. We see opportunities that we normally don't see if we are not present and mindful. Because mindfulness means integration of many parts of the brain at the same time, at the same moment. So the information we process is huge. And it's beyond our rationality. That's it.
Very good. Thank you. Thank you very much. I think it's this puzzle about how the mind affects to our physical being, and probably since you are working with different kinds of diseases, but particularly tumors, maybe there is an understanding how this actually, do we sort of engender, do we kind of push these through our minds, do we push these sicknesses and illnesses to happen, or do you think that they just come randomly out of the complexity of life?
No, they come out of the other. So scientifically, we know that where some pathologies are coming from, and there is a scientific explanation that is very important, because thanks to this, we can then build the right strategies. And well, in this sense, the scientific side is really, really important. So when we say I would rather, so it's a different thing. So basically, if a patient has a brain tumor, for example, the whole network of the brain can be disrupted. So when you operate a tumor in another part of the body, for example, the liver, you can take part of the liver out, and that's it, or part of the lung. That's fine. But you cannot take out part of the brain without thinking what the consequences could be, because the brain, it's us. We are the brain. We are our brain. So that, in this sense, the pathology affects the brain. In this sense, scientifically, we'll always have to look between the interaction of the tumor itself and the brain, how this reacts. Because, of course, the brain tries to survive itself. They try even sometimes not to be aware of the pathology. It doesn't like to have a pathology. He doesn't like to be aware of a pathology he has. Sometimes he knows, sometimes he doesn't. But sometimes, as Oliver Sacks was always describing in his books, this great neurologist, sometimes some pathologies can make the patient have, after the pathology itself, some new skills. Suddenly. They develop new great skills. And we don't know why. So, and this, once again, we are not fully aware of the potential, the potentiality of the brain itself. So there is a lot to do still, actually. There is loads of things to study. I think we just started, really.
Very, very interesting, and I think it's like it's like probably you have this feeling of going into the jungle, and you are observing what is in the jungle, and you start to see how the plants and the earth and the soil and the sun and the sky above is how they are kind of interacting, and it starts to make sense to you more and more as you go deeper. Yeah. But it's still a jungle.
It's still a jungle, definitely. Definitely.
My last question to you is that since we do this for understanding better how how future actually unfolds in a way, and in this process of unfolding, it seems to be that this is happening on every level. So when you're talking about the neuroplasticity, what do you mean by that? You mean that what is happening is that brain is like a amoeba a little bit, if it functions properly, so it can go this, it goes that way, depending on where are the needs, whoever defined those needs, but there is something which allows the brain to move in terms of the function, probably even in terms of the space. But if we think about what does this tell us about the future, and how we can sort of see that if we really want to have a different future, and world today is riddled with a lot of problems, and we want to change here a lot of things in the world, the way the society operates, and the way human beings operate, the role of the empathy. We need to have a more empathy in our societies as we become more multicultural, and so forth and so forth. So there's a lot of this kind of a demands that comes. So if we allow ourselves for a moment to think that, well, some of that doing things differently and creating a different, more just and more equitable and more sustainable world comes from understanding how we could actually use our brain capacity in a different way, or in such a way that it allows us to move towards these positive goals that we could set to our societies. What would be, if you would be the emperor, well, we are in the, in the city, Rome, which has had in the past a lot of emperors. So if you were an emperor, what would be the kind of a couple of decisions that you would like to make as to with your knowledge about how the brain operates, to push us towards that type of the future that we really want to achieve?
So every human being is different. Therefore, we have to understand the unicity of each person. And every organization should do it before putting everyone in a slot, in a little box. So this is the first thing I would do. So you need to know as much as possible of the one you're employing, for example, for a task or for a job anyway, but the unicity, why is unique? So the question is always there, why is unique? And once you understand why someone is unique, then you understand what he can bring to the organization, really. Once you understand what is the unicity of everyone, then you have to make the team, to build up the team. And once the team is built, then you have to apply some sort of mindfulness, visualization skills, mental imagery, in the way that everyone is synchronized towards a goal. So these are the way I would change the structure of how people are hired, how you can make the most out of the people, and how can they be happier, because happiness has lots of to do also with your unicity. So if you're in line with your unicity, why with yourself, then possibly you are happier.
I think with those words we can conclude. Thank you very much, Christian, to be a part of this
Thank you very much.
discussion. Very pleasure to meet you. Thank you.